Hi everyone. In this video, let us compare Tadalafil versus Sildenafil. Both of these drugs, Tadalafil and Sildenafil, are having the similar suffix, and we can clearly observe they are having the suffix -afil. This suffix -afil indicates these drugs are phosphodiesterase 5 inhibitors, commonly known as PDE5 inhibitors. These drugs are mainly indicated in the men to treat erectile dysfunction. Even though both of these drugs belong to the same category and they are indicated for same purpose, but still they're having some similarities and differences between these two drugs. For example, one of the drugs is short acting and another one is long acting. One is used at any time of the day, but another one should be used within a specific period of time. Similarly, food can affect the absorption of one of these drugs. So there are a lot of similarities and differences between these two drugs, which we will discuss in this video. So let us start one by one. The first one is a mode of action. Both Tadalafil as well as Sildenafil are classified as phosphodiesterase 5 inhibitors. PDE5 is one of the metabolic enzyme which can cleave phosphodiester bond. Cyclic GMP is one of the important substrate for this enzyme. This cyclic GMP can be converted into GMP by action of this enzyme. Now, Tadalafil can selectively block this phosphodiesterase 5 enzyme activity, as well as Sildenafil can also block this enzyme. So both of these drugs are going to inhibit the metabolism of cyclic GMP, thereby they can increase the cyclic GMP levels. So this is the first similarity between these two drugs. They are acting in similar way, but Tadalafil is having the more specificity towards phosphodiesterase type 5 enzyme. That's why Tadalafil shows more potency compared with Sildenafil because of more selectivity towards PDE5 enzyme. So even both of these drugs are somewhat similar in their mechanism of action. Still, Tadalafil is more selective towards its target. Second point, how they are supplied. Tadalafil is supplied as tablets, but it is available in two forms based on its usage. This drug is available as tablets for use as needed, as well as it is also available as a tablets for once daily use. So it can be used in two ways and it is available as tablets. When it is used as needed, it is available at different strengths such as 5 mg, 10 mg and 20 mg. But when it is used for once daily use, it is available at low strength such as 2.5 mg and 5 mg. In this way, Tadalafil is supplied in different strengths for different purpose. On the other hand, Sildenafil is again available as tablets, but it can be used only as needed. For this purpose, Sildenafil is available at a strength of 25 mg, 50 mg and 100 mg. Third one is the dosage. Tadalafil can be given at different doses based on how it is used. When it is intended for use as needed, it can be started at a dose of 10 mg for the treatment of erectile dysfunction. The dose can be slowly escalated to 20 mg based on the effectiveness of the treatment. But in few of the people with any renal dysfunction, the dose can also be reduced to 5 mg. So the starting dose of Tadalafil is 10 mg and the maximum dose is 20 mg. This is the dose of Tadalafil when it is used for the treatment of erectile dysfunction as needed. But it can also be given as once daily preparation. In such conditions, the dose is started at very low dose. It can be started at 2.5 mg. Again, based on the effectiveness, the dose can be slowly escalated to 5 mg. 5 mg is the maximum dose when this Tadalafil is given as once daily for the treatment of erectile dysfunction. Now, if we see the dosage of Sildenafil, it can be started at 50 mg dose and the dose can be increased up to 100 mg based on the effectiveness. And in few of the people with any renal dysfunction, the dose can be reduced to 25 mg. So the lowest dose is 25 mg and the maximum dose is 100 mg. Here we can clearly observe that Sildenafil is given at higher doses compared with Tadalafil because Tadalafil is more potent compared with Sildenafil. Even though there is a difference in their dosages and potency, but both of these drugs show similar effect in the erectile dysfunction. Fourth one is the time of intake. This is somewhat important because Tadalafil differs with Sildenafil at this point. Tadalafil can show a peak plasma concentration within 30 minutes to 6 hours after administration. On the other hand, sildenafil can show its peak plasma concentration within 30 to 120 minutes. So both can show their onset of action within 30 minutes. That's why both of these drugs can be taken at least 30 minutes before intercourse. But there is a difference in their duration of action. Tadalafil is having a long half-life around 17.5 hours, whereas sildenafil is having a short half-life which is around 4 hours. So because of the difference in their half-life, Tadalafil can show long duration of action, and the therapeutic action of Tadalafil can be observed up to 36 hours after its administration. On the other hand, sildenafil can show its therapeutic action up to 4 hours because of short half-life. Due to this difference, Tadalafil can be taken at any time of the day. Because of its long half-life and long duration of action, it can produce the erection up to 36 hours. So flexibility of intake is more observed with Tadalafil. Fifth one, clinical uses. We have just discussed that Tadalafil and sildenafil are both indicated for the treatment of erectile dysfunction. This is one clinical use of these drugs, but both of these drugs can be used for another purpose. They can be used for the treatment of pulmonary hypertension. Because of their vasodilatory actions, they can be used for pulmonary hypertension. So these are the two clinical use of both Tadalafil and sildenafil. In addition, Tadalafil can also be used for another clinical use. It can be indicated for the treatment of benign prostatic hyperplasia, commonly known as BPH. So among the phosphodiesterase type 5 inhibitors, Tadalafil is only the one drug which is used for the treatment of BPH. But sildenafil is not indicated for BPH. It is mainly indicated for erectile dysfunction and pulmonary hypertension. Sixth one, side effects. Here both Tadalafil and sildenafil show similar side effects which are common to all the phosphodiesterase 5 inhibitors. So these drugs can show headache, dizziness, flushing, redness of the skin, myalgia, muscle pain, nasal congestion, back pain, which is more pronounced with Tadalafil because of long duration of action. Even they can produce some change in the vision, which is more pronounced with sildenafil because of less selectivity towards phosphodiesterase 5 enzyme. Finally, these drugs can also produce skin rashes as another side effect. So side effect profile is somewhat similar with both Tadalafil and sildenafil. Seventh one, prolonged erection. Here again Tadalafil shows some difference. This drug shows some long duration of action up to 36 hours, whereas sildenafil shows short duration of action up to 4 hours. So both of these drugs can produce prolonged erection, which is called as priapism, where the erection can be observed for greater than 4 hours. But Tadalafil is having the more risk for development of this prolonged erection because of long duration of action. Eighth one, effect of food. Here Tadalafil shows some advantage. This drug is having no effect of food, so it can be given either with food or without food. Sildenafil is somewhat similar, but its absorption is affected by presence of fatty food. Because fatty food reduces the absorption of sildenafil, in presence of fatty food, this drug takes more time to work, so onset of action may be delayed in presence of fatty food. Such type of food interaction is not observed with Tadalafil. Ninth one, effect of alcohol. Sildenafil can produce some vasodilation, so when it is combined with alcohol, it can produce some hypotension, which is not that much significant with moderate intake of alcohol. So sildenafil can be taken with alcohol. On the other hand, Tadalafil shows somewhat difference because of long duration of action. When this Tadalafil is taken with large amounts of alcohol, it can produce some significant hypotension. So this results in severe dizziness and severe hypotension, which is fatal to the patient. That's why large intake of alcohol should be avoided with Tadalafil. 10th one, use of nitrates. Nitrates are one of the anti-anginal agents. For example, nitroglycerin is one of the nitrate, isosorbate dinitrate, isosorbate mononitrate, all these are commonly known as nitrates. These nitrates are indicated for the treatment of angina, where they can reduce the cardiac pain because of their vasodilatory effects on coronary blood vessels. Since Tadalafil as well as Sildenafil can also produce vasodilation, these drugs should not be combined with nitrates and they are contraindicated with simultaneous use with nitrates. So both of these drugs are contraindicated with nitrates. But in the people with any risk of angina, which drug is better? Because Sildenafil shows short duration of action of 4 hours. After 4 hours, nitrates can be taken if any anginal attack is observed. But in case of Tadalafil, because of long half-life up to 36 hours, nitrates cannot be taken within 36 hours of Tadalafil intake. So if nitrates are given within these 36 hours, there may be a risk of severe hypotension. So in the people with any risk of angina attack, Sildenafil is more better because of short duration of action. So these are the 10 similarities and differences between Tadalafil and Sildenafil. Even both of these drugs are PDE5 inhibitors. Each drug is having its own advantage as well as disadvantage. So that's about the comparisons between Tadalafil and Sildenafil. Hope this video is useful to you. If you really enjoy this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.